Track 1 focused on the research and treatment horizon in dementia care. Dr. Richard O'Brien, chairman of the Department of Neurology at Johns Hopkins Bayview campus, discussed the diagnosis of dementia and how to differentiate it from mild cognitive impairment. He talked a lot about the concept of the stew of dementia, whereas we like to, particularly in medicine, divide things into nice organized pie charts that are such and such a percentage is this, such and such a percentage is that is really not the reality that we all face in our clinical practices, in that in actuality it's more of a stew of lots of different things. Our average age of our practice is 91 in our outpatient clinics, and our average age of our home is a little younger than that, but still quite elderly. And I like to say that nothing in geriatrics is ever black and white. It's always shades of gray. And so we have to kind of focus on those different shades of gray. We also discussed the frequent existence of comorbid conditions, such as hypertension and vascular disease, and the role that these conditions play on cognitive loss. One of the takeaway points is that today, at the current state of the art, there is not much we can do about Alzheimer's dementia in particular, and many of the dementias. Once people have dementia, once people have progressed to that point, there's very little we can do other than provide supportive care. The key is to try to identify these people early and try to prevent it. And one of the takeaway points from Dr. O'Brien's lecture was that one thing that we can have an impact on is vascular disease. So if there's one thing that we're going to try to really focus upon is trying to intervene to prevent strokes in particular, but vascular complications. So if a patient has the beta amyloid plaques, the hallmarks of Alzheimer's dementia, there's not much we can do about that. But if we can prevent strokes that take out those few remaining synapses, those few normal areas of the brain that are left, that may be our biggest bang for the buck, so to speak. So focusing on vascular disease, treatment of hypertension in particular is very important. We also discussed treatment options, including pharmacologic therapies currently on the market, such as the cholinesterase inhibitors, and future treatment options, which are great in number, but still quite uncertain in clinical practice. The reality is that the current treatments do very little. They can be of some limited benefit, but there is no curative, there is no magic bullet out there, and certainly the answer to the problem does not lie in the form of a pill, certainly not at this point. Dr. Marilyn Albert, our keynote speaker from this morning, was able to provide further insight into dementia, its impact on our healthcare system, and some of the tools that we can utilize in assessing and caring for those with dementia. She also focused on the concept of mild cognitive impairment. This is a somewhat debatable concept even now. And how do we determine that if someone has what we term mild cognitive impairment, who is going to progress to full-blown dementia, where we need to intervene, and who is going to simply continue to be the somewhat forgetful aunt, but always has been that way and is always going to be okay? It's a very difficult concept, and Dr. Albert provides some insight there as well. Dr. Rosenzweig, the Chief Clinical Officer of MedOptions and a board-certified geriatric psychiatrist, offered his perspective in the treatment of behavioral disturbances in dementia, in particular the role of antipsychotic use and misuse in this disease, and in addition, the treatment and recognition of depression, which is incredibly under-recognized and undertreated in geriatrics, and is a critical component if we are going to address the problems that are associated with dementia, both in our caregivers and in our patients and residents alike. Again, please feel free to finish up your lunch. In a few moments, our CEO, Warren Slavin, will come up again to the podium to introduce our afternoon speaker. And again, thank you all for your time and dedication and commitment. We look forward to working with you in the future as well. Thank you.